Hi, I'm Dr. Nan Boss, owner of Best Friends Veterinary Center. We've always been really big here at Best Friends on wellness and preventative care. We want to prevent whatever we can prevent, and we want to diagnose early so we can treat early anything that's actually going wrong. So one of the big parts of wellness and prevention is evaluating and addressing risks. So we vaccinate your pet because it has risk for contagious diseases. We do once a month parasite prevention so that your pet doesn't get parasites because they have risk for that. There's a lot of risks that have to go with lifestyle. So if your cat goes outdoors, we have risk for diseases that we wouldn't have if the cat was indoors. A dog that goes hunting or goes up north where it has exposure to deer ticks and other outdoor sort of things. Blue-green algae would be another thing we worry about with hunting dogs in the water up north. Those sorts of things have to do with lifestyle. There's risks that occur with time, so dental disease builds up and we address the risk of periodontal disease and organ damage by taking care of the teeth. We have risks with age itself, so as the pet gets older, the liver function, kidney function, thyroid levels can all start to change and have problems. One part of risk that you probably haven't thought a whole lot about is the risk that comes from a pet being a certain breed. Different breeds of cats and dogs have susceptibility to different disease problems. Some of these are extremely common. 40% of purebred dogs have at least one genetic defect, and the average dog carries genes for another 4 to 5 problems that it could pass on to its offspring. Many of these diseases can be tested for, again allowing earlier and more successful treatments, and also to let breeders choose whether their dogs are healthy enough to breed. Some genetic problems can be screened for with DNA testing. So this is Donna Kane. She's one of my clients and she's an owner of Australian Shepherds. All the herding breeds, including Aussies, are prone to a genetic defect. It's called MDR1. And if a dog has 2 copies of that gene in their DNA, they are not going to handle some medications very well. The most common one that we worry about is ivermectin, which is one of our once-a-month heartworm preventatives. There's also some chemotherapy and anesthetic drugs, and Imodium AD, which we use a lot in dogs for diarrhea. So we're going to adjust our drug and management protocols for these dogs depending on whether they are a carrier for that MDR1 gene. There's 2 main diseases that I have to worry about with a Doberman of this age. The first one is von Willebrandt's disease. That's a disease that was discovered by a doctor named von Willebrandt many years ago in humans, and what it is a coagulopathy. So it causes a dog or a person to have hemophilia, where they can bleed to death from even the smallest little cut or wound. They certainly can have abnormal bleeding from a surgery or for a dental extraction. So for Dobermans, we have a DNA test that we can do to see if they have that gene, so that we can test them before we do surgery on them and know for sure whether we're going to have a problem. Some inherited diseases are diagnosed using simple screening tests versus DNA tests. For example, miniature schnauzers are prone to dry eyes. We can measure tear production easily with a little paper strip test called a Schirmer tear test. So Schirmer tear test is pretty easy. We have a little paper strip and it has a little ribbon of dye in it. And we hook that onto the lower eyelid. And then we just let it sit for 1 minute. And so that strip is going to get wet with the tears that Callie is hopefully producing, and we'll be able to measure how many millimeters of tears she produces over the course of that minute. So that if it is starting to drop, we can initiate treatment before the eyes are so dry that the dog develops painful corneal ulcers. Persian cats are very prone to cysts in their kidneys. About 1/3 of Persian cats will die of polycystic kidney disease. So doing urine screening every year helps us to pick up kidney damage early so we can address it. Taking hip x-rays when a dog or cat is young lets us find hip dysplasia early so we can start treatment to reduce damage to the hip joints over time and to keep the dog or cat more comfortable. Did you know that Maine Coon cats are prone to hip dysplasia just as some breeds of dogs are? Arthritis and orthopedic problems are not just dog problems. Cats get these same diseases. The more you know about the risks your pet has, the better you can prevent or reduce risk yourself at home, too. If you know your dog is at high risk for tearing a cruciate ligament in his knee, then maybe having him jump into the air over and over again chasing a frisbee is not the best form of exercise for him. Dachshunds are very prone to slip discs in their long backs, so training them to get on and off furniture using a ramp or steps instead of jumping on and off could save you and your dog from a $3,000 emergency surgery for paralysis caused by a ruptured disc. There are hundreds of dog breeds, each with their own set of risks and recommended testing. Cats have a lot of genetic diseases too. There have been over 180 genetic cat diseases identified so far. In humans, new babies are tested for over 100 genetically linked diseases with just a drop or two of blood. We haven't progressed nearly that far in veterinary medicine. So far in dogs, each genetic disease is screened for with its own test, and in cats there are few DNA tests available yet. However, the science of genetic screening is advancing at a rapid rate and more tests are being developed all the time. Even mixed breed dogs can have genetic defects, so testing to find out what breeds your dog is a mix of is valuable too. A wisdom panel test will tell you your dog's breed heritage and also identify some genetic defects carried by some of those breeds. This is my dog, Izzy. Izzy was a stray, so we don't really know a whole lot about her family origins. We did DNA test Izzy, and sure enough, she is part beagle. So even mixed breed dogs can have problems that are related to genetics and their DNA. So Izzy has a long back and short legs, not as long as a dachshund, but still enough that she will have chronic stress of her lower back from spending her life jumping on and off of things. Genetic screening not only allows us to identify and treat problems in individual dogs and cats, but it also allows breeders to screen for genetic diseases before they are passed along to future generations, creating healthier, longer-lived pets. Genetic screening is fast becoming the standard of preventive medical care. Which screening tests or preventive measures your pet needs will depend on a lot of factors, genetics just being one of many. Your veterinarian will evaluate your pet's individual risk factors and develop a healthcare plan just for your dog or cat. It will include recommendations for genetic screening along with those for vaccinations, parasite prevention, dental care, weight management, age-related screening, and all the other things that we talked to you about. Your pet is special and deserves a care plan that is comprehensive and proactive so he or she can lead the longest, healthiest life possible.